Hi, this is Dr. Phil Straw. I'm back at you today. I get a lot of patients that ask me about, hey doc, should I use ice or should I use heat? And they always ask me these questions day in and day out, and it really depends on the situation. Is this an acute injury or is it a chronic injury? When I say acute, in the terms of ice, if the injury is 48 to 72 hours old, then ice is really beneficial because it can help bring down the inflammation. After that period of time, personally, I'm dealing with chronic pain people, a lot of chronic back and neck pain. These people have had pain for months, if not years. And so it really depends on the patient, whichever feels better to them. But typically, if we're starting with an acute patient, if you do ice, the benefit of icing, it brings down the inflammation and it helps numb the area so you don't feel the pain. So it has an analgesic effect. The key with ice is don't use it more than 20 minutes, 15 to 20 minutes at a time. If you go over 20 minutes, your body actually thinks it's getting hypothermia and it'll start bringing more blood to the area. And the whole idea with the ice is it brings down inflammation by decreasing the circulation, by vasoconstricting all the vessels in that area. So anything more than 20 minutes is going to work the opposite. So no more than 20 minutes on the ice. I usually tell patients 15 to 20 minutes tops. Now if it's a chronic patient, most of them actually already know what feels good, and most of them will tell me heat feels the best because with chronic pain you have a lot of adhesion, scar tissue, a lot of tight muscles, and a heat pack actually helps relax that area, or a hot shower or a jacuzzi. And so when you use heat, you can use that anywhere, depending on how hot it is. You can leave that on for over an hour if you wanted to, or you can be in a jacuzzi for 30 minutes at a time. You just kind of get to experiment with it and decide, see what feels best for you. But heat and ice are really beneficial. Ice is really good for an acute injury or an acute flare-up. Let's say you had a long-term condition like a back pain, but you just worked in the yard and it got really sore overnight. Then you might want to try ice too. The other thing you can do is a combination of heat and ice, where you actually put heat on for 15 minutes and then follow it up with ice for 15 minutes. And so patients like that a lot too. But you really got to experiment and see what works best for your body. And a lot of people ask me, what should I use for an ice pack? Well, you can get those thermal ice packs just about anywhere at any sporting goods store. Or if you really want to get creative, you can just get a bag of frozen vegetables like peas and use that as an ice pack too, and just put it back in the freezer. Anyways, I hope that helps you. If you do have chronic conditions, usually heat works better. And with acute conditions, 48 to 72 hours, usually ice works better. But we'll talk to you soon. Thanks a lot.